Radiofrequency denervation, also known as radiofrequency ablation, is a minimally invasive procedure performed for the management of chronic facet joint-related back pain and may be performed for more sustained relief than the continuous use of painkillers. Facet joints are small joints located throughout the spinal cord. Pain signals from facet joints are carried by the medial branches, and radiofrequency treatment works by disrupting these pain signals. The procedure is done under local anaesthetic, and the radiofrequency needle is accurately guided by X-ray near the irritated medial branch nerve. A radiofrequency electrode is inserted through the needle, and a small electric current is passed to check the position of the needle. Finally, the electrode is heated to stun the nerve and thereby preventing it from transmitting painful signals to the brain. We asked pain specialist Dr. Nathan Taylor from the North Shore Private Hospital in Sydney to tell us a little bit more about the radiofrequency treatment and the devices that he uses in practice.
What is radiofrequency denervation?
So, radiofrequency denervation is the use of radiofrequency heat energy to lesion the small nerves that supply the sensation to the facet joint. So it's only used to treat facet joint pain, which can cause back pain, particularly in older people and people with arthritis. And it's putting a needle down next to these small little branch nerves that come off from the nerve root and supply sensation to the facet joint. So if you put a needle down, use radiofrequency energy to heat it up, it will lesion that nerve. It does grow back slowly, between 6 months and 2 years, but in that time the patients are getting less sensation from the facet joint and therefore less pain, so they can be more active.
How long does traditional treatment last if it's worked successfully?
Yeah, so the nerves they regenerate.
Yeah.
We tell patients between 6 months and 2 years. I'd say most successful treatments last 12 to 18 months. Sometimes people come back a little sooner. Sometimes I have patients after 3 or 4 years that come back for a repeat treatment. You just do the treatment again. It's a day procedure, and generally they'll get the same response again.
Are there any adverse side effects from the treatment, and how long do they last, and what sort of degree do they get to?
Like with any treatment for pain, we always say there's no pain so severe that an operation or procedure can't make it worse, so that's always a risk. That being said, if all the safety precautions are taken out, it's pretty rare. Things that you'd worry about, so you'd say things that are common but less severe, post-procedure pain, yep, that often happens. You get a flare-up, but that would usually settle, or ineffective, so they might have had a false positive response to a diagnostic block, and then they don't get the relief that they're hoping for. They would be the less severe but more common problems. If you look at things that are serious, infection, again very rare and treatable. Serious nerve damage is a possibility, but it's the way that we do safety checks, which involves looking at with an X-ray, looking at where the needle is from a number of angles to get a three-dimensional idea of where the needle is. But then secondly, from the tip of the needle where we're going to do the lesioning, we do some test pulses and turn up the voltage so that we know that within the area of lesion we're not getting any of the major nerves down the leg. They significantly reduce the risk, but it's always a risk.
Would you say that this treatment, radiofrequency, is a better alternative than painkillers?
Well, it always depends on the patient, and it's only for a select group of patients with low back pain, so people with facet joint pain. But we know, particularly with opioids and the long-term use of opioids, is not an appropriate treatment for non-cancer pain, and this is something that can reduce patients' pain symptoms. The other thing we look at for treatment is, options for reducing the pain level down, so radiofrequency ablations, trying to avoid medications, but there is anti-inflammatories and things can help with arthritic pain. But then the other thing is working on other strategies and how to manage the pain, which you can do in combination with treatments.
All right, so this is the machine that we use for radiofrequency denervation, so it's the RF generator. There's electrodes, leads are plugged into here. You can have 4 at a time. What we can look at doing is sensory testing first. That tells us if our needle is close to the nerve, and then motor testing as well can tell us that we're not near a nerve that we don't want to be near, and then we do the lesions. You can set the temperature that it goes at, the voltage, and the duration just by pressing on different settings.
Thank you, Dr. Taylor.
You're welcome.
Radiofrequency denervation has applications beyond just managing lower back pain. It can also be used to provide targeted relief from other forms of chronic pain, such as abdominal pain, This is achieved by ablating the splanchnic nerves that relay pain signals from specific visceral organs. Radiofrequency ablation devices are also used in the safe and effective treatment for many cardiac electrophysiological pathologies. Arrhythmias like ventricular or atrial tachycardia, flutter, fibrillation, or ectopic beats. RFA may one day be a standard treatment for heart failure with preserved ejection fraction, as the results of a recent first-in-human study of greater splanchnic nerve ablation suggest. On consultation, physicians also informed us of their frustrations with not being able to adjust the output of radiofrequency ablation devices. Perhaps this could be a promising future avenue of research for any one of us.